always listen to your gut because no one knows your dog better than you do, right? And although we may have expertise in the medical side of things and our opinion is very important, when it comes down to it, if you have something in your gut telling you it just doesn't feel right to me, you have to listen to that.
Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is Dr. Linda Loudon. For those of you that do not know her, she is the founder of the Dog Mom Society, amongst other things, but also she is an emergency our room veterinarian. She's slowly weaning away from that. She got into functional medicine, using integrative medicine to help support her patients, and just a myriad of different things. Dr. Loudon, I'm so happy for you to be here because we're both trying to get to the same set of issues in terms of solving things for pet parents, or more importantly, helping them solve problems and know how to work through issues. The thing is that pet parents more than ever, because of the care shortage, have got to be really profound advocates for their pets, and that's not something we're teaching them as veterinarians to do. Welcome. And I'm really excited in terms of being on the receiving end in the emergency room. How can pet parents start to really understand how to prepare for those visits, and in the face of a crazy storm, advocate for their pets during those visits?
Yeah, thanks so much for having me. This is my favorite topic to talk about because I think it's so important and so needed. I was just on the phone with a really good friend the other night, 2 nights ago. Her dog had hemangiosarcoma and had a bleed, and she was in the ER. And I was her advocate for her. I was on the other end telling her what questions to ask and what things meant, because I've been on both sides, right? I'm out here on the internet, online, trying to teach guardians how to be advocates, but I've also been an ER doctor for 22 years, and I understand the ER doctor's perspective as well, right? We've got a waiting room filled. We're seeing every kind of different emergency. Animals are dying, owners are going through a traumatic experience, and it's very hard and impossible to give everybody the attention and time that they need in that situation. And I could feel it through the phone for my poor friend who was in this high energy stress situation dealing with losing her dog. And it's just really sad. And I was so grateful I could be there to be her advocate. And then I get off the phone with her and I think, oh, how many other owners need an advocate tonight to be able to speak to know which questions to ask? So I think the best thing we can do right now as a guardian is to prepare for that. Write down some questions in a notebook that you would know if this situation arrived, that what you want to ask. What are the most important questions? Because when you're in it, your brain's not, you're not thinking the way you normally would through things. And so some of the questions would be, one, when you're entering the ER, try to find your strength in that situation as an advocate, but also have some understanding for what's going on for the ER vet and the situation, right? So that you can approach it in a way from understanding, but also from strength, where set some boundaries, right? When you go in, right? If my dog doesn't need to be in the back for life-saving care, I would rather him stay with me in a room, right? That's a boundary that you have the right to set. That's your pet. Another boundary would be, I would really like to be part of every decision for my pet. Could you please let me know what treatments you're going to give before you give them? If you're going to do any diagnostics, I really want to be a part of that decision. And then when they do recommend diagnostics, ask them, okay, great, thank you. What do we hope to get out? What information do we hope to get out of that diagnostic tool? If you have financial concerns, or if you just want to do it a step way, say, can we do the most important test first? Get some answers and then go on to the next test. If you have insurance, I would say do the tests the doctor recommends, like the blood work, a fast ultrasound, and an x-ray that will help move things along for your pet. But if you are financially concerned, ask for the most important test at a time and then get that and then move on and see, because maybe you'll get an answer from that first test and not need other testing. So those are just some of the things that I would say. Have a notebook, write down these questions. If you're going to an ER, sometimes your dog may need surgery, right? Some questions to say, if they come back to you and say your dog needs surgery for this condition, is it absolutely necessary? Is medical management not an option? What are the costs, right? I would like an itemized estimate, which is standard for ER clinics to do anyway. And then for that surgery, it's okay to ask, how many of these types of surgeries have you done? How comfortable are you with the surgery? I see you know what you're doing, and I really respect that you're here for me tonight, but I'm so nervous about my dog going into surgery. So I just a little bit more information. Just approach it in a way that's understanding for that vet who's probably pretty stressed and doing their very best, but in a way that sets some boundaries for your pet and being that advocate. Sorry, that was long-winded.
But that is so true, and I think that's really critical because it is so frustrating on both ends, right? Because for the veterinarians in there, as you mentioned, they are up to here in patients and doing their very level best to try to keep their heads above water and keep as many patients on the planet as possible. And unfortunately, that comes at the cost of being able to have that conversation and truly provide informed consent instead of just, this is what we need to do and I'm going to go do it. So I think what you're saying is absolutely critical. And I think, um, what maybe it's amazing that you were able to be that lifeline, for lack of a better descriptor, for your friend. And that's a good strategy too, is that if you've got a friend that's a pet person, that could be what keeps you grounded enough so that you're not getting sort of that deer in headlights look because it's so overwhelming, and your friend is able to help you remember your list of questions. So, super good strategy. It's to go into a human ER is, and unfortunately, I had quite a number of those experiences about 6 or 8 years ago. But I have to tell you, I've done emergency work in in the day clinic setting. I got completely overwhelmed when I had to walk into an ER and say I have chest pain. The response was so fast and so overwhelming that I completely panicked and shut off. And so from that experience, I have a better understanding of how many pet parents must be feeling as they are entering the situation where it's just utter chaos and frenetic energy going on. And so thank you for that. You started talking about this a little bit in terms of scripts or to have in your mind about ways to communicate with veterinary staff that's going to make sure that your needs are met, but also that you're not offensive or saying things that are shutting the staff down immediately. And you mentioned a couple of those, but how do you do that, especially when they've said, okay, this is what we recommend you do, but you're not super confident or comfortable with that option?
Yeah. I would say, number one, always listen to your gut because no one knows your dog better than you do, right? And although we may have expertise in the medical side of things and our opinion is very important, when it comes down to it, if you have something in your gut telling you it just doesn't feel right to me, you have to listen to that. And I know that in that situation where the energy is so stressed and high, it's hard to hear that inner voice. And so, but when it comes, that is so important because I've had so many clients tell me, like, I knew it was the wrong decision, but I did it anyway. And they beat themselves up for it. We all do that, right? So listen to your gut, your dog, and your dog is talking to you, whether you know it or not, during these situations. So find that space. And next, just say, ha- have that conversation with the vet that says, okay, I hear you. I hear you. And that makes sense why you're recommending that. I'm not comfortable with it. And I just might need a second opinion. Do I have time for a second opinion? Can I make a phone call? And maybe it's just a phone call to talk to that friend or spouse, partner, and say, I just need a minute. I need to talk through this. And I just needed some quiet space to think through it before making big decisions. Because a lot of times, if you're in the ER, they're huge decisions, sometimes life ending decisions. And sit with that. If it's a decision where the vet is saying you have to do this, or they're pushing to euthanasia, right? And you're feeling like, I'm not ready for this. I don't think my dog is ready for this right now. Ask the vet, can I make my dog comfortable tonight and make this decision in the morning? Is that possible? Is that an option? Because a lot of times, I would say at least 90% of the time, that is possible. There's that 10% where no, we can't. Actually, your dog is in a state where we can't make them comfortable, and we have to make a big, bold decision here. And it's either all or nothing. And there are those options, and your vet may say, this is an all or nothing situation. And then you have to make that bold decision. But ask, can I make my dog comfortable so that we can sit with this decision? And hopefully they say yes. And then some of the scripts too, like just asking for clarification. Say, thank you for explaining this. Could you walk me through why this treatment is totally necessary? Or what are the potential risks if I don't do this treatment? It's not feeling right to me. Ask for alternatives. Are there approaches or treatments that we could consider that could also address this issue, but just from a different angle? I always say antibiotics. If a lot of people go to the ER for things like diarrhea, and the first thing that's going to be recommended is metronidazole, an antibiotic. But we know, right, that is not the best choice in most cases, that the gut flora is already pretty messed up because we know the dog has diarrhea as a symptom of that. Now we're going to wipe out gut flora for a few weeks with metronidazole. So know these kind of things, get that information, learn as much as you can about your dog's health so that when they say, we're going to put your dog on some metronidazole for diarrhea, say, is there another way that we could approach this without the metronidazole? What are your other opinions on that?
Right on. Yeah, because there's that paper that showed that actually a symbiotic was as or more effective than metronidazole without the repercussions on the gut flora.
Yeah.
And it's like a lot of things. It takes a while. It takes a while for medicine to change because this has been this standard of care for so long. That's the automatic response for most of us as veterinarians. But it is critical for you as a pet parent to be aware of this.
And one thing I would say about,
Present it.
sorry,
Yeah, present. Yeah, go for it.
one thing I would say about ER doctors, and I'm saying this because I was that ER doctor in the first part of my career, is that we do come out, we get thrown into things, right? And then we get protocols that, okay, this is what we do for diarrhea, this is what we do for hit by car, this is what we do for vomiting, this is what we do for pancreatitis. And we get rigid with those because it's easier for us, right? Because we're seeing crazy appointments every 15 minutes, every 5 minutes sometimes. An ER doctor is going from a puppy room into a euthanasia, into CPR, into trauma surgery, right? So if we have protocols that are pretty straightforward, that, oh, the diarrhea, send them home with metronidazole. Oh, it's got vomiting, we're going to give it Serenia. We're going to give it some famotidine, and we're going to give it some sub-Q fluids. And so understand that is most ER's doctors' way. It's the way we've been taught. It's the way we've been conditioned. And so when you come to them and say, I'd like to not treat this with antibiotics if I can help it, they're not always going to understand that. And then you might feel some resistance. And I understand both sides, if that makes sense.
No, it totally does. And I get it. If you're in that situation where you're having to see a patient in 5 minutes that you should be able to spend 20 minutes with, there is no time to think about it. And I get it. That's why we go to these default protocols, because you can do it without really thinking. And that's a plus in terms of being able to see that case volume and deliver some level of care, but it's a real problem for individual patients because they're not able to receive the individualized care that they need. And that was a disturbing trend almost 10 years ago. It's the concept of conservative management of various conditions, especially intervertebral disc disease, just disappeared. And all of a sudden, my clients were being offered $10,000 surgery and MRI or euthanasia and nothing in between. So, no pain medication, something for muscle spasm, that kind of stuff, to give them and their pet a little bit more time to be comfortable to go to their regular vet or to their integrative vet to get some alternative treatment. And I think it's frustrating, but unfortunately, that's where protocols take us, is into that space of not being able to offer the middle way. And that's super frustrating.
Yeah. Or treating the patient in front of you, right?
Yeah.
Because maybe that protocol is good for one patient, but not for the other.
Yeah. Yes, and that's the other key thing too, is that personalized medicine that keeps being talked about on the human side and the veterinary side isn't really happening.
Yeah.
Because a 3-year-old dog with intervertebral disc disease is a very different patient than a 12-year-old dog with Cushing's disease or something else on top of it. There's a lot of different considerations there.
Sure. Sure.
Yeah, yeah.
And
So
that's where that advocate, like, I really, and I'm sure we'll talk about it because you and I have talked about it, where that advocate within that ER would be so valuable. And I really hope that we trend towards that, where there is that go-between person that is part of the staff who can have the conversations with the owner and actually have time to hear them and make it a more personalized visit while the ER doctor is doing their doctor things.
and running around like trying to keep up brutally. So, but let's do talk about that a little bit, because that's something that started to happen on the human side, that patient advocate, that patient care, patient educator. There's a lot of different roles it's been called. So, how would we relate that from the human side to the veterinary side? And this is where we're struggling, right? As veterinarians, we don't have these alternative
Yeah.
fields, for lack of a better descriptor, yet.
Yeah. And I like, the way I could see it is having that person, holistic pet coaches, I think are a great example of that, because you could have someone with knowledge who has the knowledge of the holistic side of things, integrative side of things, that the ER doctor hasn't had time to learn, right? It's not a lack of, you can go both a few ways with this though. I feel like ER vets, we come out, we work our butts off, just like in human medicine. You're working 14-hour shifts, you're working 4 to 5. That's right there. I don't even think that's right. When I look it back, I don't know how I survived the first few years of my career. Wasn't healthy for anybody. So I think that's also changing because people aren't willing to do that anymore. People are, I think COVID woke us up to, wait a second, I'm not going to go back to that. I didn't go back to that after COVID. I was like, nope, not going back to my 14-hour days now that I've seen what life could be like without it. Yeah. But I think having that, and ER vets don't have the time, or they're not leaving or making the time to do that continuing ed on other things rather than just the ER stuff, right? We put our heads down in the books for our ER. We get really good at critical care. I know, because that's what I did. And we forget our innate healing powers. And I did that. When I got out, I was like this healer. I grew up. I was like healing birds in my hands when I was little. And then I came out and I was like, I want to be the best ER doctor. And I put my head in the books. and I learned critical care and surgery as well as I can, and I practice. And then I lif- lifted my head up one day in a patient that I couldn't heal with conventional meds, and I was like, wait a second, I forgot
Oh, yeah.
healer. I forgot the healer in me. And we all have it, especially if we've decided to dedicate our lives to helping animals. And I think our ER vets, especially, we get so busy, and we get so busy trying to do our best and learn the ER side, that we forget that we're healers. And that if we could have that advocate come in who is trained in holistic care, integrative care, doesn't have to be a vet. It could be a vet, great, but it doesn't have to be. It could be that middle ground where they could come in and say, okay, this is our conventional options. What else can we do? What else can we pull out of our toolbox to help this patient? And I know that eventually ER vets would be thankful for that rather than resistant to it. Because I know that when in my busiest days, if I had someone come to me and say, what if we tried this and we could do this instead of doing all of the conventional things? I would be like, yes, that would be great. But I think we got to get there, right?
It's definitely a process for sure. And that's the thing too, is that I think it will take some time for like a holistic pet health coach, somebody that can help explain to the client both the conventional explanation and how that, and that's it, right? As an ER doc, you know how that protocol is probably going to go. So, for instance, we talked about diarrhea. Oh, we give them metronidazole. We know probably in about a month, maybe 6 weeks, they're going to be back again with diarrhea because we just annihilated the rest of their microbiome. So, if there was a person in the ER that could say, we can do this.
Mhm.
However, most often, blah, 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 this is what happens. So the other option would be, let's try some sort of a probiotic with a prebiotic in it, a symbiotic, or, another type of organism that is likely to support the microbiome and relieve the inflammation in the gut, and do this with the food, do this at home, and give you those good old options. That level, and really what that is nursing care, which the veterinary technicians don't have time to do either.
Mhm.
And so that's the thing, is the whole enchilada, for lack of a better descriptor. Here's your options, and then this is the person in the clinic that has time to explain what the doctor said, what they meant, what the likely outcome is. And obviously they would be working with the doctors to help understand that from their perspective. So it's not just somebody grabbed a bunch of stuff from Facebook, but they're truly working with the doctors within the clinic to explain, this is what our protocol is, but we know that likely this is going to be the outcome later. And while it will provide some symptomatic relief, it's likely not going to get at the heart of the issue for them. So
Which is
there is that.
the big thing about medicine these days is we're just band-aids, treating symptoms and adding more and more chronic meds to these poor dogs. That's instead of getting to the heart of it, having the conversation about real food, having the conversations about why is this diarrhea happening every 4 months? Why is your dog getting an ear infection every 4 months instead of here's your drops, here's your cleaner, we'll see you in 4 months.
4 months, yeah. Yeah, exactly. And I think that's critical because we've got to make that shift from band-aids to root cause uh,
Yeah.
work. Otherwise, we're going to see this escalate worse and worse. And then, frankly, from an antibiotic stewardship perspective, it's just making all of these bacterial resistance issues escalate because we're handing out not the lowest gun, for lack of a better descriptor. We're handing out the big gun stuff because it's a brand name product, and that's that company helped design the protocol for whatever that condition is. But what we're ending up with is massive amounts of resistance. Even with metronidazole, that's been a generic drug for decades, we now have horrid resistance to metronidazole by Giardia and several other protozoal organisms because it's been given for every kind of diarrhea, not just an amoebic or cyst-based diarrhea. So I think that's the other critical thing too, is that we've got to really protect our conventional resources so that when we need them, they're going to actually work.
Yeah. Yeah. And I can tell you, I've been also a euthanasia vet for 22 years. I've had a euthanasia business. It is terrifying and sickening, the pattern that I've seen as a euthanasia vet. Because when I first started out, I was euthanizing old dogs on their bed who it was their time. They were 15, 16, 17, 18, and it was beautiful and it was their time. They lived their full life. And now I've I've had 2 weeks in a row with 4 hemangiosarcoma patients. I have patients who are euthanized because of skin disease, where they've wiped out all of their endocrine systems with prednisone over their lives. And when by the time I get there, they're way beyond me ever getting them back. And because these dogs have just been chronic med after chronic meds that have huge side effects, but also these dogs are just being given things and also fed things that are causing this chronic inflammation. And so these dogs are my average dog euthanasia now is probably 8 or 9 years old at the most. And it's heartbreaking. And that's the average. If I get a 15-year-old dog, it's, oh, nice. This is
Thank
great.
you. Yeah, this is normal.
This is
But
normal.
but you're right. So if we take that adage, and we can debate whether this is true or not. If for every human year, it's roughly 7 dog years, we're euthanizing dogs and cats that are 50. That's really gone backwards in veterinary medicine in terms of lifespan and health span. And I think those are concepts that conventional medicine isn't really addressing because they don't have the tools yet to do that. But one of the and this is where the problem comes in, right? Because conventional medicine is all about the prescription bag of food and the brands that basically educated the veterinary profession on nutrition. But we've touched about this, danced around this a little bit, but you and I both believe that if we're not feeding whole foods to our pets, how can we expect a different outcome? So talk about that a little bit. You're seeing it on both ends in terms of vet in the emergency room, and then also these poor animals that have been suffering from chronic disease from as early as 2 years of age to the end of their very short lives at 6, 7, 8.
Yeah. It's it's common sense that we've forgotten is common sense, right? And we'll do it for ourselves, where we'll say, if we expect us ourselves to live with vitality, we know that we have to eat fresh foods, not processed foods. For my kids, I'm not going to feed them the same cereal for every meal and expect them to thrive. I would never do that. And most parents would not do that. But when someone tells us that's what we should do and that's what we must do in order for our dogs to thrive, we accept it. And we can't accept that anymore. It's not common sense. It doesn't make sense for our dogs. These kibbles that are ultra processed, they're high starch carbohydrates, they produce carcinogens, they lack moisture. Dogs need 70% moisture in their food, and kibble maybe has 8 to 10% moisture. We see all of these allergies. We know that there mycotoxins and storage mites in dry kibble is, adding to that, all of these allergies that we see with dogs. And we have to look like you don't see the chronic inflammation like these allergies. It's so rare to see a dog come in with not one symptom of an allergy.
Yes.
And that could just be anal glands that need to be expressed. Anal glands should not need to be expressed. If you're taking your dog in to have it on a regular basis, just to have the anal glands expressed, that's a symptom of an allergy. And it's likely due to that, what that dog is eating. The licking the feet, the biting all the time, nibbling on their paws, ear infections. Every dog has got them. What are we doing wrong? And when the main thing we're doing is we're not feeding them fresh food.
Um, it- and this is the other thing that's so frustrating to me is that we're in this beliefs of this mindset that feeding dogs should be easy. You just dump it out of the bag and that's it. And feeding ourselves should be that easy, right? We just
Mhm.
pull the thing out of the freezer and throw it in the microwave because it's time saving and et cetera, et cetera, et cetera. But this is the single most important thing that we can do for ourselves, for our pets. And in doing this, the other thing is that, yes, we're going to feed the microbiome appropriately. Yes, we're going to help the immune system respond more appropriately to things from the outside. But the other critical thing is that we're going to minimize the amount of toxins that we are consuming in our food. And I think that's the big buzzword is detox and toxins, et cetera. But the truth is that DDT and glyphosate and all of the things we worry about, they are now in the water cycle. It is going to be decades before these things go away, even if we stopped using them all together tomorrow. So DDT was banned in 1968. It still shows up in the cord blood of American children today because it's in this water cycle. And so it's critical to be able to minimize the intake of toxins through food, through water. That's the other thing is that if you're not using some sort of water filter, especially ones that can get rid of PFASs and glyphosate and all these other chemicals we worry about that we know have a huge and profound impact for much the worse on health, then we are setting our pets up for disaster. If we're feeding real food, then we're feeding appropriate amounts of foods and types of foods to help to optimize the microbiome and optimize cellular structure without introducing more toxins into the body.
And we know certain breeds have markers, hereditary markers for, say, hemangiosarcoma, pit bulls, Goldens. But we can turn those on and we can turn them off, those genetic
Right.
markers. And one of the key ways that you're going to turn them on is through these toxins, especially through the food, through the environment, if you're spraying. And if the more you can eliminate, the better chance your dog, even if he does have these genetic markers, is going to be able to keep it at bay and not turn into a cancer or chronic disease.
Right on. And that's the other difficulty too, is that because we spay and neuter these guys so early, we are never allowing them to develop a fully competent endocrine system. And that definitely does not help any of this. And I think it's one of the big factors in why we see so much cancer in these guys. The statistics are just obscene. How is it that 25% of all dogs in the United States will develop cancer and 50% of dogs over 10? That just is absurd, and yet that's the truth.
Yeah. Yeah. And I think that back when I got out of vet school, I didn't know any better. I was in shelters spaying and neutering dogs because I thought that I was doing volunteering and doing my part. And when I started to read studies, that's common sense too, isn't it?
Yeah.
It's if you think about taking out these organs when these babies are 8 weeks old and they're not even had a chance to grow, how could we not think that would have a detrimental effect?
Yeah, and it's a double-edged sword, right? Because you and I are both old enough to remember, like, when I started practice in 1990 in Charleston County, South Carolina, the SPCA there took in something like 45,000 animals every year, and they euthanized 38,000. And so that's where all the goal of these spay neuter programs was to stop that type of suffering. Unfortunately, we opened a whole nother box of problems that we had no clue were going to be there because we didn't think it all the way through. It wasn't done out of greed or malice. It was done to try and solve a problem, but we created a massive one, unfortunately, on the back end. And that's what we were all trying to do, was to make things better, but it went a little sideways on us. So we talked a little bit about toxins, we talked a little bit about food, but one of the other things I think people need help with is understanding what are common practices in veterinary clinics, but maybe are better avoided because they could impact long-term health. For instance, there's the core vaccine schedule, and leptospirosis was just made a core vaccine, which is bizarre, but there you are. So let's talk about that a little bit, because that's one of the other things I think folks need some information so that when they're in the veterinary office, and thankfully not in an emergency situation, where they can take a deep breath and say, maybe not. And so what are some of those things that pet parents typically get offered that maybe aren't the best option?
Yeah, and I think you touched on the vaccines. That's the first one that comes to my mind is you want to avoid unnecessary vaccines. Giving a pet or human a vaccine where that's unneeded, that's unnecessary, that they're already covered for that disease actually does harm. It doesn't, you'll hear vets say, oh, it won't hurt. Actually, it will if that patient is already covered for that disease. And one case that, this case was one of the ones that kind of got me out of the ER and online because I was like, I have to reach more people. But it was a 16-year-old cat living his best life, indoor only, hadn't been vaccinated since he was a kitten, recently had just some symptoms of drinking a little bit more, a little bit of weight loss, eating a little bit more. Otherwise, great. And the owner was like, I just want to make sure that I was doing everything possible. So I took him to the vet just to get him checked out. And that vet gave him 4 vaccines that day. And he came to me within 6 hours and he was dying. And I spent the entire weekend trying to save him. And I couldn't. I had to go in on Sunday and tell her, I'm sorry, I can't save him. We tried everything. And this guardian, I have to see this guardian fall to the floor thinking that she's just thinking that, why did I take him to the vet? Why did I let him get his vaccines? And that is something that could have been avoided, should never have been done. We knew he had a chronic illness. He had some symptoms. Blood was drawn. It was sent to the lab, but he was given the vaccines before that result came back. And a 16-year-old cat that is indoor only does not need any vaccines, in my opinion. And so every dog, every cat is different, is an individual. There are certain reasons that I think they should never be vaccinated again if they've had an allergic reaction. The whole, we'll give him Benadryl next time before he gets a vaccine. Those are the cases that I see 4 years later in my ER with immune-mediated disease because they kept getting the vaccines. They were given the Benadryl, so we didn't see those outward symptoms, those outward red flags that inflammation was happening, but the inflammation was still happening inside this dog. Every year they kept getting these non-core vaccines, and then I see them 4 years later for a disease that not every time I can't always save them from. So knowing what a core vaccine is, what a non-core vaccine is, choosing titers, testing their blood to see, are they already covered? Do they have enough antibodies for this that they don't need a vaccine? Rather than just going in and getting it is a great alternative. No sods are another alternative. But really understanding vaccines, and before you go into that clinic, know what you're going to say yes to and what you're going to say no to. Dogs with chronic diseases should not be getting vaccines, in my opinion. Their immune system's working hard on that chronic
Well,
illness, and they don't need
yeah.
the
Well,
unnecessary information.
and frankly, if you read the label for all of these products, these injections, it says for use only in healthy dogs or cats. And if your dog has a disease or a cat has a disease for which they're on medication, that's something where you need to have that conversation with your veterinarian and say, "Hey, look, let's table this for another time because X, Y, and Z. My cat's taking this and that and the other." And it's going to be interesting. I think unfortunately that ban on discussing immunizations from the human side may be coming over to the veterinary side. So we'll see what YouTube thinks about this conversation. So I'm putting that out there for those of you watching this, and then maybe you'll see this in a different format a bit later. So one of the things we are both doing, you're doing some really cool stuff. Let me put this out here first, is that you are educating pet parents on how to make options, how to understand what's being offered to them. And I just want to share this a little bit. You created the Dog Mom Society some time ago. Let's talk about that a little bit because this is a great place for pet parents to go to get information that you have personally vetted, that you're able to really offer them education. The goal is to be able to help pet parents make empowered decisions. So talk about how you started this group and why. We've danced around this a bit.
Yeah, thank you. Yeah, this was one of my solutions, hopefully, to like that owner, that guardian, that of that cat. How could I get to these people before they were in this situation and help them make a better choice? And so I thought, okay, let me start a membership, because when I went online at first and I saw these Facebook groups, I'd go into them and I'd be mortified by some of the information they were getting. And I was like, all right, I need a safe space for guardians who really are dedicated to protecting their dogs. They want to make the right decisions and they want the information in order to do that. And so that's what the Dog Mom Society became. It's a safe space, a membership where we meet every Friday, and we have just the same people that will come every week. It's our cute little, we call it our pack chat. And I learn from my guardians every week too. We talk, we share, we ask questions. I'll read blood work. I'll look at a urinalysis. If someone was in the ER that week, we'll talk about it and plan a detox if that dog is going through something. It's a place where people can get their questions answered and trust that the answers are, it's good information. And then I have monthly live trainings where I have experts come in and give a training on their area of mastery. We've had Rita Hogan, Angela Ardolino, we've got Isla Fishburne, who's an amazing dog communicator. She's coming in January to start the year. So it's
Cool.
my safe space for my guardians.
That is amazing. And I think that is so needed because there is so much information and some of the Facebook groups get, ooh, wow, okay. And there are things that people are offering out of genuine concern for others' pets, but some of them can be a bit dangerous. And then likewise, I mean, if you're dealing with a chronic condition for your pet, you don't have access to an integrative vet like Dr. Loudon or her group, or you've got a dog or a cat that has a myriad of conditions. That's where holistic pet health coaches can be incredibly helpful because they are able to walk through what is going on with your pet and help you understand both from a conventional uh, understanding and then alternatives, help you understand how to deal with nutrition, with supplements, and not come in with 27 supplements at one go. I think that's been critical because a lot of these chronic illnesses really require somebody that can help you pivot through changes because if you've had a dog with diarrhea for 6 years, it's not gonna get better with one visit. This is really a process where somebody needs to work with you and support you in all of the stuff that's gonna come up. Because at the end of the day, we call it practice because it is indeed that. How do we learn how to do better? And we try our best guess, and then when that's hopefully effective the first time, if it's not, then we pivot, and we create another solution. And that's part of what the coaches are trained to do, is to help you navigate lifestyle solutions and help you know, no, this really is time. You need to go back to your vet and discuss what's going on and some other options that are out there. So I think on the human side, that's been incredibly helpful for so many people to understand, okay, I really do have to lay off the Fritos and start eating the green beans, and why that's important, and then prove it to themselves over time. But one of the yeah, so that's it, is that, and then how do we support people that are pet pros already, and how do we educate them to learn how to do better to get their messages across? And that's part of what you and I are both working on, is how to elevate the paraprofessionals.
Yeah.
And
And I would say for, within my Dog Mom Society, I have a lot of your pet health coaches in there, and I will refer to them for a lot of my pet moms because they're talking nutrition on a daily basis. They're coaching nutrition. There's ones that's all they do. And that's not all I do. And they're better at it than I am. So I'll tell my dog moms, here is a pet health coach, a holistic pet health coach that can help you and guide you. And they get that support from someone who that's all they're doing, because your vet is not trained in nutrition and they're not the person to ask for that kind of stuff. You want someone who that's their focus, that's their area of mastery. And that's what you're teaching, Dr. Roberts, is for them to choose these areas and really go deep on them so that they can be that trusted reference. And I appreciate it because it's helped so many of my dog moms.
oh, that's awesome. I'm glad to hear that, because that's the goal, is to cut through all of the orthorexia, for lack of a better descriptor. I think that happens with nutrition. We get into these ideas that it's one way or you're doing it wrong. And I think that's what we need to understand, is that this, again, is an area of personalization. What works for one dog or cat may not work for the next one. And so we have to have that person that can help you understand, okay, this is not working for your pup.
Mm.
So there's a couple of other cool things I wanted to share as well. So, one is that if you are remotely interested in being a holistic pet health coach, we have a webinar coming up on the 11th of December at 1 p.m. Eastern. Drop the link in here. You can register for this masterclass, learn more about what it means to be a coach. And then lastly, I have something really fun, and that is we're giving away C60, which have you used this supplement before? Do you know about it?
No.
It is really cool. So C60 is a 60 carbon molecule that actually forms a ball. What's in here? This has been a great detox tool for pets because it's in avocado oil. It's a relatively small amount. And so for small dogs and cats, it's been a no-brainer in terms of being able to get something into the body that will absorb reactive oxygen species and help to reduce that chronic inflammation and improve protection from oxidative molecules. So what we're doing is we are giving away of this product because it's such a fun thing. So for the folks that registered for our Black Friday, Cyber Monday giveaway, I'm gonna hit this wheel and see who comes up. Got a 30% chance. And so it looks like it's for Lori. And Lori, we will get in touch with you, which will be super fun. And then the other one is from folks that actually ended up purchasing from us on Black Friday, Cyber Monday. We've got another giveaway of C60 for them. So let me see if I'm smart enough to do this. There we go. We've got a lot of more folks in here, so I'm going to spin this one more time. Exciting. David Scripter, looks like you are the winner there. That's super fun. We'll be getting in touch with you, sending you some C60 for you to try for your pets. It's been awesome for Hayo. It's super easy. It's 5 drops of the oil. She eats it in the food, so it's an easy no-brainer for a picky dog and cat for sure. So this has been a really fun conversation. I think we'll have many more of these. Again, for if you are looking for your first best option for help, go check out the Dog Mom Society. I think you've still got some holiday specials going on this, or
Yeah, what we're doing is if you choose the yearly option, half of your fee, the cost of your membership is going to go to a canine nonprofit, either Monkey's House, which we both have mutual friend Michelle Allen has Monkey's House, which is a beautiful sanctuary. And then we also have Dog Rose in Romania, which is another one of my friends' shelters there. And so you get to choose where your 50% of your yearly payment for the membership goes. We just wanted to do something that Black Friday that's more giving and to help out these beautiful canine, give back to these other canines so they get the help they need as well.
that's so awesome. Cool. Dr. Loudon, thank you so much for joining today, and we will be talking soon in the future. For all of you that joined us, I hope this was useful, very informative, and just know you have options out there. So until next time, we'll see you.